A few years back, AADE did a research project and they looked at diabetes education as a career path. They asked healthcare professions faculty and nursing students to complete a survey on their perceptions of diabetes education as a career path and so on. And I was asked to analyze the open-ended results. And in those results, I found overwhelmingly that nursing students feel that people with diabetes are lazy, they don't take care of themselves, they're non-compliant, they're uncontrolled, and I kept seeing those words over and over, and I thought, maybe if we could change the language around diabetes, we'd change the perception around diabetes, and we would actually entice more people to enter the specialty. And so we included a paragraph on that in the paper, and one of the reviewers picked up on that and said, this is something the AADE should be doing and promoting. And so from there, we proposed a white paper, and the white paper quickly turned into a joint position statement with ADA, and now we have a joint paper on the use of language in diabetes care and education.
The language of diabetes can't be separated from the experience of diabetes. And I think that what both Jane and Melinda and I what we are talking about, and all the authors on the paper, is that when we talk about diabetes, how we think about it, how we talk about it to and about people with diabetes, we can either create or help create an experience that's engaging, that's empowering, that invites people into their care, or unfortunately, we can talk about it in a way that's stigmatizing, judging, blaming, shaming, and pushes people away. And how we talk about it really matters.
Healthcare professionals, such as diabetes educators, can use more effective language in a variety of ways. I think the first step is read the paper. There are 5 really clear, concise recommendations that we elaborate on that are based on the research, but also give some specific examples of how to really think about how words matter clinically in your own practice. I think another step is really listen to yourself. Listen to the words you say, the words you write. Listen to those around you and identify through discussions with your team ways that you can be saying things perhaps in a more positive, hopeful way. And look at the other things that are written in your healthcare setting, maybe that you didn't write, but think about the way that messages are out there. I think the more that we begin to listen and observe, the more areas we can find for improvement. And maybe the third thing is take a look at the list of words in the paper that identify words that are more problematic and more preferred. And don't think of them as like a rule-based do's and don'ts list, but an opportunity to identify areas where you, yourself, and your healthcare team can make some small improvements or big improvements.
The language paper is published on the websites at both AADE and ADA, so you can click on the link to access it right now.